So, a daily pill to treat COVID-19 could be on the market if it is given the green light by the FDA. The top contender is a drug from Merck. The New Jersey-based drug company says that trials show its experimental COVID pill can reduce hospitalizations and deaths by half if people recently infected with the virus. Now, the company is seeking emergency authorization. If it's approved, Merck's drug would be the second antiviral treatment for COVID. So for more on this, let us bring in Dr. Ali Mokdad. He is the Chief Strategy Officer for Population Health at the University of Washington. Thank you so much for joining us. So this sounds like quite a game changer if it's approved. What can you tell us about this new Merck drug, and how's it different from remdesivir? And how soon could we see it available to the general public?
It all depends on the clinical trial that we haven't seen yet, but it will be a game changer for sure. The fact that it will help reducing hospitalization is timely for all of us right now, coming into winter where we will expect a surge from COVID-19 and a pressure on our hospitals. So this would be very needed at this time, and it will be a game changer.
So the initial surge of COVID-19 deaths appeared to skip over much of rural America in the early days of the pandemic. That appears to have changed with new data from Kaiser Health News showing that those living in rural areas may be dying of COVID at twice the rate of urban Americans. Is there a disconnect between what's perceived to be happening with COVID in rural America and the reality?
In many ways, yes. Unfortunately, when COVID-19 came to the United States, it started in big cities, New York, Seattle here. We were the first to be hit by COVID-19. Rural communities in the United States felt they are immune. They haven't seen it as much as big cities. But we have seen these patterns before. If you look at HIV, for example, it started in big cities when it went to rural community. When the message came about prevention and treatment, it kind of disappeared from urban settings, but it's still stuck in rural communities. It's a combination of socioeconomic factors and, of course, vaccination, low vaccination rates in rural communities.
So then, what do we do? How do we address this issue in these communities? I mean, I kind of remember, Vlad, kind of early on in the pandemic when it was really hitting the big cities, you could watch the news and know what's going on, but you could just, look in your community. Chances are you knew somebody who had tested positive or somebody's, parent who might have been in the hospital. But in rural communities, it had not hit them yet. So it was difficult for them to take it as seriously because they just weren't seeing it. Now it's different. But still the message is not getting out there. How do you get that message to the areas that are in need now?
We need two messages to go out to rural community. The first one, of course, is prevention. Basically, go take the vaccine and keep wearing your mask when you are outside your own home. And that's the only way to prevent a surge of COVID-19. Working with the community's leaders, churches, anybody who's in that community, people would listen to. We need to roll our sleeves, get down to that community and work with them. That's the first message. The second message that's very important for rural community, they don't have as much hospital capacity to take care of their patients. And that's very important for them. They're more at risk of dying if COVID-19 hit them, because simply it will take them a long time to get to a good hospital to treat COVID-19.
So let's talk about what's happening right now in the state of Washington and whether or not it reflects what we're seeing nationally with COVID infections as deaths drop in parts of the country.
So in my state, the state in general has done a very good job controlling COVID-19 through a lot of mitigation measures, and they've made the right decision at the right time. However, within our state, like at the national level, there are disparities in the way COVID-19 has affected our community. Rural areas in the state of Washington, especially on the east of the state, are more hesitant to take the vaccine, and they have lower vaccination rates, unfortunately. And their lifestyle hasn't changed. So wearing masks is very low in this community. And you see a lot of pressure on our hospitals on the east side of the state and the rural community in our state. And that has been, unfortunately, a pattern that we have seen across the United States.
Doctor, I want to ask you about...
Go ahead, Emery.
Oh, sorry, Vlad. Did you have a follow-up question for that?
No,
because I was going to pivot.
That nailed it, yeah.
Okay, so I want to ask you about something sort of completely different that I know you have a particular interest in. Several months ago when we were really having a lot of conversations about reimagining public safety, what do you do when in regards to police violence and police shootings, there was a conversation that it needs to be treated as a public health issue. And you took part in a peer-reviewed study by the Lancet that found that more than half of police killings in America are actually not reported in official government data. So we don't even have an accurate snapshot of this. It also found that Black Americans are more likely to die from police violence than white Americans. I don't think that comes as a stunning surprise to people. You say that police violence is a public health crisis. Do you believe that? And what actions, should policymakers be taking to reduce these numbers? There was all this talk about a massive policing overhaul bill, and there are a lot of negotiations, but it seems to have kind of been pushed to the side for now.
Yeah, it's police violence is for sure a public health issue, and then we need to discuss it. And yes, everybody knew there are underreporting of mortality or killing by the police in the United States, but now we're able to document it. And of course, that's what we do at IHME. If you can't measure it, basically you can't fix it. And it's very important to put a number out there and say we need to deal with it. But to come back to your question, what should we do and how we move forward? We need to change our way of doing policing in the United States. Our police force has a lot of weapons. They're trained in their training is it will escalate and you need to be ready to take care of yourself, protect yourself and shoot. And then we send a police to a place sometimes that are ill-equipped to deal with it. For example, you want a police to go to somebody who's robbing a bank with a gun, but you don't want to send a policeman to a house dispute where a husband and wife are having a fight, or a homeless person, or somebody who has a mental health condition. We never had to kill anybody in our hospitals. Our nurses, our social workers never had to kill anybody. They can deal with it because they're properly trained to do it. And we need to revisit that in the United States.
All right, Dr. Ali Mokdad, thank you so much for your insight. We appreciate it.
Thank you.